we're here to launch the results from the Integra Initiative, a project implemented in Kenya, Malawi and Swaziland and managed by IPPF, the London School of Hygiene and Tropical Medicine and the Population Council. I'm most honoured to welcome Her Excellency President Banda from Malawi.
How very refreshing it is to be among friends. I feel highly honoured this evening to be a guest speaker here. Issues relating to sexual and reproductive health are very close to my heart as they have great impact on the livelihoods of the poor. Integrated sexual and reproductive health and HIV services save money and are more efficient than the provision of standalone services. My government has put great emphasis on an all-sector involvement policy in addressing issues of sexual and reproductive health. And we have a very active civil society that is helping government to address such issues. Through the support that Family Planning Association of Malawi got from the Integra report, the capacity of the organization has been strengthened to deliver comprehensive integrated youth-friendly sexual and reproductive health services.
My name is Edward Marienga. I'm the Executive Director for Family Health Options Kenya, which is a member of the International Planned Parenthood Federation. Actually, Integra has meant a lot for us because when we started Integra, we were not integrating very many services. But after Integra, many of our facilities are providing integrated services where all our clients are able to get services in one roof. It's like a one-stop shop. I hope Integra will contribute a lot to the world in terms of research because we are looking at the integration. For example, many national governments are still not able to integrate services. But after Integra, through the research, we've been able to learn a lot of ways of working effectively and efficiently.
For me, Joyce Banda is a representation of what African presidents should be doing. African presidents should be taking to heart SRHR issues of their countries, adding budgets, being passionate about it and speaking about it and committing, just not by saying, but by doing.
I think Integra has actually meant a change in terms of how I am working, in that we've been able to apply the theory into practice. As government, we actually saw the results where the clients were able to access services in totality. To me, as a government employee, we've actually replicated the best practices that we have learned from the Integra work that they have done with FIPA.
At the time when Integra started, the HIV agenda and the sexual and reproductive health agenda were running in parallel. What Integra have done is to create synergies and open possibilities for collaboration between two areas or two dimensions that were not in synchronicity. They were not talking to each other.
I think one of the most exciting things about the project is its collaborative nature and the diversity of all the partners who've been so involved from the very beginning of the project.
When I tested positive, I thought maybe that's the end and I will not have a baby. It's all ended. But it helped a lot, the integrating of services, because I received the counseling before I got pregnant. I received the counseling for having the child, that it's possible that although you're HIV positive, you can have a child. So I go for ongoing counseling for prevention of mother-to-child transmission. So finally I got pregnant to my 5-year-old girl. She's negative. I was very happy to have all the services in the same room because it made me feel like I am still a woman.
Integra has the potential to be a game changer because it has looked at perspectives from both the client and health provider perspective, as well as also looked at the economic side of things and looking at the cost efficiencies related to integration.
So with Integra, it means that we can, for the first time ever, we can robustly show that what level of integration is associated with better health outcomes.
It'll provide evidence which we haven't had before. It's generating new evidence around what is the impact on women's lives of having access to integrated services.
The role of the media is to bring to the notice of government that there needs to be constant change. And so working hand in hand with researchers and organizations like IPPF to inform government policies and hopefully influence it from an evidence-based.
It will be interesting to see how IPPF could utilize the results from the Integra Initiative and apply the evidence in other countries where HIV is affecting most vulnerable groups. For example, men who have sex with men, transgender people, sex workers, and people who inject drugs. So these results are bringing a new body of evidence that might be utilized in other settings outside Sub-Saharan Africa.
I don't know if this group is seeing what I'm seeing, the stubborn link between the population growth in Africa and poverty. And unless we tackle that, we will continue to do this work and not succeed. I have said to women, don't you think this is enough? You have 10 children, don't have any more. And she has looked back at me and said, you have wealth, I have children. Unless we tackle poverty, children will be born. Thank you very much.
Integra is groundbreaking.
Integra is all services under one roof.
Integra is informative.
Integra is holistic care.
Integra means opportunities.
Integra is transformation.
Integra is services made better.
For me, Integra is a paradigm shift.
For me, Integra is going to give a lot of lessons to apply.
Integra is ambitious.
For me, Integra has been innovative.
Integra is choice.
For me, Integra is passion, is the belief that when you put things together, something better will emerge.
Integra is the bridge. It's my bridge to cross over to the other side.